This is Radiology in a Minute. My name is Frank. I'm a Deputy Editor of Radiology and Training from the Department of Radiology, USC School of Medicine. In this brief presentation, we will discuss this newly published study on using CT-based imaging criteria to diagnose clinically significant portal hypertension in patients with chronic liver disease. The gold standard of diagnosing patients with clinically significant portal hypertension is through hepatic venous catheterization and measuring the hepatic venous pressure gradient. CT-based features of portal hypertension may provide a much less invasive modality to assess these patients with chronic liver disease for portal hypertension. In this retrospective study, the contrast-enhanced CT of 235 patients with chronic liver disease from two tertiary centers in South Korea were analyzed. CT features of portal hypertension were assessed by two blinded radiologists. These features included splenomegaly, which was measured in three different ways: gastroesophageal varices, spontaneous portal systemic shunts, and ascites. Three image-based diagnostic criteria were developed and compared, which are listed in this slide. In the 235 patients analyzed, the criterion B, which utilizes splenomegaly and one additional CT features of portal hypertension, achieved the highest specificity and is best suited for root-in diagnosis of clinically significant portal hypertension. The presence of one or more CT features of portal hypertension achieved the highest diagnostic sensitivity and is the most suitable to use to rule out clinically significant portal hypertension. When combining the rule-in and rule-out criteria, the radiologists were able to correctly diagnose up to 80% of the patients as either having portal hypertension or not based on CT alone. In conclusion, CT-based diagnostic criteria appear to achieve reasonable accuracy in diagnosing patients with clinically significant portal hypertension.